Hello, everyone. Welcome to the webinar, Justice During a Pandemic, Legal Empowerment Approaches During the COVID-19 Crisis. This is a virtual roundtable discussion to reflect on how we carry on with our legal empowerment work to address the justice challenges brought about or aggravated by the current global crisis. My name is Marlon Manuel. I work at the MATI as Senior Advisor to the Global Legal Empowerment Network. I am based in the Philippines, so good evening, everyone. Before we start, just a few reminders. Please note that this event is being recorded, and we will share the full recording and highlights later on our website. We will try to keep the roundtable discussion to not more than 1 hour. And then after that, we will have about 30 minutes for questions or comments from the participants. You will see a questions panel in the GoToWebinar control panel. There is a questions panel where you can send us, you can type in your questions or comments, and you can communicate with us during the webinar. There is also a raise your hand button in the control panel to get for raising your hand to get our attention if you want to speak later on during the open forum for a question or a comment, and feel free to try it now. Okay, let's start. To open our discussion, I will call on Namati CEO Vivek Maru to give some framing remarks and to set a context for today's conversation. Vivek.
Thank you, Marlon Manuel, and thank you everyone for taking this time. We are living in a perilous moment. My sister and her husband, they practice medicine at Elmhurst Hospital in Queens, New York City, which for the United States is the specific place that has been hit hardest by the pandemic. And they are, my sister and her husband, they are shaken by what they have been seeing. And in particular, what they have been seeing is that the ones who have been suffering the most, the ones who have been hit the hardest, the neighborhoods and the families where there is the greatest death and suffering, are the ones who have been denied the right to fair housing, denied the right to a living wage, denied the right to equal access to services. Those are the people that are getting hit the hardest. And that's the thing about this virus. It exposes and exacerbates the injustices we are already living with. The same is true for the measures that governments are taking to respond to the virus. When a government like the Indian government issues a lockdown with little notice, little preparation, who gets hurt the most? It's the migrant workers, the daily laborers, the people who have already been barely getting by. When governments issue stimulus and economic support packages, we are seeing that the fossil fuel industry and other large corporations are securing generous handouts, while the fate of ordinary people remains in limbo. And some governments, and Faye is going to speak to this, are misusing this crisis to tighten authoritarian control. So the pandemic exacerbates injustice. And that means that the pandemic demands a great deal from those who are committed to the pursuit of justice. It demands a great deal from every single person on this line right now. But there's a puzzle, because normally people working for legal empowerment, it's in our DNA to organize, to build power, to bring people together. That's what we do. But because in this moment we need to protect ourselves and protect our communities, at least for a while, at least physically, most of us need to stay apart. And so in order for us to rise to this moment, we are going to need to find ways to do our work virtually, by phone, by email, by radio. We're going to need to dig deep and get creative. And I believe we can. It can feel glib to speak about silver linings in the face of mass suffering of the kind that we are seeing right now. But there is an opportunity in this crisis, because when everything falls apart, there's a chance to rebuild something different, something better. And we want to seize that opportunity. That's why we're coming together here today.
Thank you, Vivek. To lead today's conversation, we have gathered esteemed network members from across the globe and across issue areas, working on different justice issues, coming from different organizations. Let me introduce them. I will start with a colleague in Amati, Daniel Sesay. Daniel is a senior program officer at Namati, Sierra Leone. He is an expert on customary law and community-based paralegal programs. Prior to joining Namati, Daniel served as a lead paralegal for Team Up for Justice in Sierra Leone and the Truth and Reconciliation Commissions. He is a tireless advocate for communities affected by large-scale land acquisition. He works with communities in protecting their land and natural resource rights. Unfortunately, we cannot show Daniel's webcam because of some connection issues. But Daniel is here with us. Hi, Daniel. Daniel?
Hi, everyone.
Yes, Daniel. Can you please give us a brief description of Sierra Leone in the current crisis?
Yes, Sierra Leone also registered its first index case 2 weeks ago, and now we are so far registered 11th case as of this morning. The country is under partial lockdown, with traveling between districts restricted, and a curfew, a 9 p.m. to 6 a.m. curfew already enforced in the country, and that's also a state of emergency at the moment.
Okay, thank you very much, Daniel. We will hear more from Daniel about Sierra Leone later. From Africa, we go to South Asia. I will introduce Madurima Danuka. Madurima is the program head of the Prison Reforms Program at the Commonwealth Human Rights Initiative, CHRI, based in India. She is a lawyer with an LLM in criminal justice from the University of Nottingham. She has been working with CHRI since 2008, and the primary focus area of her work is to engage in systemic interventions to reduce pretrial detention, strengthen prison oversight, ensure access to effective legal services for persons in custody, and to further the realization of rights of vulnerable groups in prisons, including women and foreign national prisoners. Madurima, hello.
Hello.
Hi, Madurima. Can you please share briefly India's current general situation?
Yeah, hi everyone from India. So we are recording more than 10,000 cases as of today and with over 300 deaths. The country has been in lockdown since 25th of March. And today there was a decision made to extend the lockdown till 3rd of May. So the cases are continuing to rise. And yeah, we're just seeing what's happening in other parts of the world and hoping for the best.
Okay, thank you, Madurima. We'll go back to you later. From India, we now go to Latin America. Let me introduce Felipe Mesel. Felipe is a lawyer who graduated from the National University of La Plata in Argentina and specialized in social legal studies on urban land at the National University Autónoma of Mexico. He now works in ACIJ, Asociación Civil por la Igualdad y la Justicia, or Civil Association for Equality and Justice, a CSO based in Buenos Aires, Argentina. He is currently involved in ACIJ's Right to the City program and working on an action research project on legal empowerment practices with communities in informal settlements in Buenos Aires, in La Paz, Bolivia, and in Quito, Ecuador. Hola, Felipe. How is Argentina? How is Argentina?
Here in Argentina, the government has taken some early measures compared to other South American countries, such as Chile or Brazil, ordering compulsory social distancing and isolation before we reach 100 confirmed cases in the country. This means that from March 20 until now, nobody can go out from their houses except for those who are carrying out jobs that are considered essential, such as health services or food production or distribution. But due to these measures, the numbers are partially controlled. And according to official numbers, there are no more than 2,300 infected people and less than 100 deaths. 2 days ago, also the first slum dweller died of coronavirus in Buenos Aires. So we are a little bit concerned about the situation and what will happen from now on in informal settlements.
Okay, gracias, Felipe. From Latin America, let us go to Europe. We have Jasminka Frishchikj. Jasminka is the executive director of ESE, or Association for Emancipation, Solidarity, and Equality of Women in the Republic of North Macedonia. And Jasminka has been with ESE since 1996 and has held the position of executive director since 1998. And before that, she worked as coordinator of ESE's legal program. She graduated from the Faculty of Law Justinian Primus in Skopje. And now, as executive director, she works in several areas, such as improving the health status of women and the Roma population, ensuring equal access to justice through alternative mechanisms for legal assistance and support, and enabling access to poor and vulnerable groups, especially Roma and women who suffer from domestic violence cases. Hello, Jasminka. Can you please give us a brief description of the situation in North Macedonia?
Hi, everyone. Regards from Republic of North Macedonia. We are a very small country, which is with a population of 2.5 million, just in order to kind of estimate the real numbers of the pandemic influence. So as of 2 days ago, we have 854 cases of this disease, which is approximately 41% on 100,000 people of population. We have 38 deaths till now, which is making 4.4 lethality rate actually. The lockdown was introduced on 16th of March, and 2 days afterwards, which is on 18th of March, the state of emergency was announced, which of course changed most of the situation. And then about the curfews, the first curfews were introduced on 21st of March, and they were changed afterwards. I mean, there is a change of the hours on which the curfew is kind of taken on. And of course, the period of the curfews is prolonged over the time.
Thank you, Jasminka. So from Europe, we now go back to Asia, this time Southeast Asia, from my country, the Philippines. We have Faye Marie Borde. Faye is the Deputy National Coordinator of the Alternative Law Groups, a coalition of 23 legal resource CSOs in the Philippines. She's a lawyer who started her practice in a private law firm, working mostly on corporate law matters, but eventually she decided to pursue a career in public interest and human rights lawyering, and specifically focusing on environmental justice issues. She also serves as the litigation coordinator for ALG's Environmental Defense Program. She's in charge of managing fellows and law student interns, as well as training paralegals. And she also participates in policy advocacy issues. Faye, please share our current situation here in the Philippines.
Hi, everyone. Good evening from the Philippines. The Philippines has been on enhanced community quarantine since March 16. It was supposed to end today, but there was a decision to extend it until the end of the month. As of today, there are 5,200 confirmed cases, and there have been 335 COVID-related deaths with 195 recoveries.
Thank you, Faye. I think Philippines is the highest in the Southeast Asia region among the ASEAN countries in terms of the number of cases. Okay, before we continue, we have a quick survey for the participants. We now have more than 290, close to 300 participants. we will have a quick poll. Martha will launch the poll, and you will see a question. So please please respond to this quick poll. Okay. So if you can see the results, we have 92% of the close to 300 participants in a lockdown or shelter-at-home situation currently, and only 8% are not, and that is representative of, I think, practically the entire community, the global community that we have. Okay. Let me introduce, last but not the least among our lead discussants is Whitney Adams. Whitney is an expert on pandemic preparedness and response. She has a Master of Public Health degree and has worked in global public health and development for 17 years. She led CARE's pandemic preparedness programs for 4 years, including during the 2009 swine flu pandemic. Although she's not serving in an official capacity for the COVID-19 response, Whitney was an implementer and advisor to the World Health Organization, the Centers for Disease Control and Prevention, and USAID for pandemic preparedness program. Hi, Whitney.
Hi, Marlon. Thanks for asking me to join this morning.
Yes, and I will go ahead. I will go right to the questions for Whitney. So Whitney, based on your experience in previous pandemics, how do you see this crisis unfolding in the next few months? Do you see the situation improving or deteriorating?
Right. So I'll give a quick as I can, a little 5-minute overview of what we can see, what we can expect to see over the next few months and indeed over the next year or two. I definitely want to stress that no one is an expert on COVID-19, regardless of what they say. So there's some of us who have worked on pandemic preparedness for years. There's some who are virologists. There's some who are epidemiologists, but we are all still very much learning. So I definitely want everyone to take anything that an expert says with a grain of salt, as they say, and understand that things can very rapidly change. But as we're gathered here virtually this morning, the world is close to 2 million cases, and we've unfortunately passed 120,000 deaths, and this is really just getting started. So COVID-19 is a disease caused by a new virus, which means no one on Earth has any prior immunity. And when a novel virus acquires the means to transmit efficiently from person to person, which this one does, it triggers a global pandemic. And while the vast majority of people are going to recover, the sheer number of people who will fall ill is going to cause quite a bit of global disruption and mortality. So we've been really fortunate that in our lifetimes, we have never yet experienced a severe or a moderate pandemic. Unfortunately, this is it. So we are about to experience something that's going to be completely unprecedented for the next 12 to 24 months. So as our poll has shown here, we have already seen life change for most of the world, and we can really see that change happening in, I'd say, 4 distinct zones. So the first is in East Asian countries, China, South Korea, Japan, Taiwan. They have all experienced their first wave of the disease, and they've suppressed it. So they're experiencing continued outbreaks, they're experiencing climbing cases, but they are continuing to control it. However, that control, it's still coming with very significant disruptions to life. So no country is returned to what we would think of or call normal. The European Union, Europe, the US, we are now in our first wave. So most of these countries are at their peak or just coming off of our peak deaths and peak hospitalizations. So we are just starting to figure out what life might look like in the next couple weeks and months and what restrictions we might start to lift. So here in the US, we're at about 580,000 cases, 23,000 deaths. So where Vivek's sister and brother-in-law are working is one of the hardest hit areas that may be experiencing their peak this week. Where I am in Georgia and another part of the US, we probably won't experience our peak until late April, early May. So you can see how all of this will affect us all at very different rates. So a number of countries, some of our participants today are coming from places like India, countries in South America, where they're already on full lockdown, but they have yet to see anything like a peak. So, and then we have a few countries in the world that are not taking significant action yet, but they will likely see impact soon. So the big question is what comes next? As I mentioned, that we can really expect life to be very severely disrupted until we get a vaccine. And a vaccine is at least a year to possibly 2 years away. The good news is that there are currently 79 vaccine candidates in development, 3 of which are in human trials already. So the pace of science, the pace of innovation, the pace of collaboration is completely unprecedented. We've never before seen the entire scientific community focused on one issue and working at this pace of collaboration and sharing. So that is a very big positive. The next step is not actually even finding out which vaccine works. The next step that you'll hopefully see is us producing the top vaccine candidates before we even figure out that they work. So what we want to see happen is that we want to have vaccines ready to go, so that the moment that we know that they're effective, we can start launching vaccination campaigns. So the Gates Foundation is one of the first to step up, and they are spending billions on manufacturing capacity for the top 7 candidates. And you'll likely see a lot more donors, countries getting in on that effort so that we can start producing things. So before we get a vaccine, we have kind of the medium term, what's going to happen the next 12 to 24 months. The next piece on that is developing therapeutics. So currently we have absolutely no idea really how to treat COVID-19, which contributes to its high mortality. On the positive side, there are 116 different therapeutics in development being tested right now, including many existing drugs. So we're not starting from scratch. WHO has launched a global multi-arm clinical trial called Solidarity, which is really going to help us speed the pace of learning. So a lot of experts are very optimistic that by this fall, we'll have 1 or more treatments that could really help ease the burden of disease. And until we have more tools to fight COVID-19, the goal is to slow the spread. So that's where the popular phrase flatten the curve comes in, that you've probably heard. So we're not trying to prevent all cases, but we're trying to slow the spread so outbreaks don't overwhelm hospitals and societies, and we can buy a time for vaccines, drugs, producing testing, ramping up our testing. Social distancing is the best tool for that. In settings where it can be done, it absolutely does work. But we all know that comes at a great cost. Even for societies that can afford to implement it, it still is very costly, and in lots of settings, it just simply isn't feasible. So in the medium term, what are the strategies that we can expect country offices to see in the coming months? So undoubtedly, many countries are going to attempt to do a lockdown. This is unlikely to be feasible or sustainable for long. And I really want to emphasize that lockdowns and social distancing, they simply buy us time. The virus will come back when you lift restrictions. So what's important is to be pressuring society and governments about what are they doing with that time. So you can see a lot of countries ramping up testing capacity, ramping up their hospital capacity, getting prepared. In many low and middle income countries, I think you'll see two major strategies being deployed. And the first one is around shielding vulnerable populations. So in shielding, instead of trying to lock down the entire population, you carefully isolate the elderly and those with underlying health conditions. And then in addition to isolating those populations, you obviously have to provide them with the care and the support that they need to make it through this time. So this is not an easy strategy at all. On the other hand, it is more feasible than an indefinite lockdown of a whole of society. So it is a very high risk strategy. If done incorrectly, it could lead to worse outcomes in those populations. So you're going to see a lot of debate. You're going to see a lot of controversy probably over that strategies and whether or not that they should be employed. The other strategy that should absolutely be employed in every country on earth is case finding, contact tracing, quarantine, and isolation. So even without good testing capacity, you could still use old-fashioned strategies to identify likely cases, isolate the sick, quarantine their contacts. This is going to require massive networks of contact tracers and people to support safe, legal quarantine that respects human rights and protects people. So India is a good example of a country that has already begun this without even having necessarily the testing infrastructure that would help. But again, this is something that can and should and will have to be done to suppress the virus and avoid complete lockdown in the future until we can get a vaccine. So I am going to pause there. I am on the Namati Legal Empowerment Online Network. There is a forum started called Ask a Pandemic Expert. Again, take that with a grain of salt, but I am happy to answer any general pandemic questions that we can during this time for you guys. So I'll stop there and hand it back over to Marlon to dive into the legal aspects that you guys are here to talk about today.
Thank you very much, Whitney, and we'll go back to you later. And thank you for announcing that that Q&A that we have in the online space. As what Whitney mentioned, nobody has any experience dealing with this pandemic, with this virus. But we have some experience with Ebola, and 5 years ago, West Africa experienced a serious crisis with the Ebola outbreak. In August of 2014, the World Health Organization declared the outbreak as a public health emergency of international concern, similar to what happened in COVID a couple of months ago. And Sierra Leone was one of the countries most affected by that outbreak. And as of March 2016, Sierra Leone had a total of more than 14,000 cases and almost 4,000 deaths. Let's ask Daniel. Daniel continued working during that time. Let's ask Daniel how Namati Sierra Leone coped and adapted to the situation during the time of the Ebola outbreak. Daniel?
The Ebola crisis started in Sierra Leone in 2014 and ended in 2016. The cases really came from our neighboring countries, Liberia and Sierra Leone. And at the beginning, very similar to what we're seeing here, the outbreak had a lot of confusion and denial by citizens and issue of politics, because the disease started in the stronghold of the opposition, and so the government was very slow to take actions. And also there are a lot of issues around conspiracy. Some NGOs, some rich guys trying to test some kind of vaccine. So there are a lot of confusion around it. And our health system, which was like one of the weakest in the country, with very small number of trained doctors and nurses, we are also very, very ill-equipped to handle the situation. And because we don't prepare for it, information about the signs and symptoms, educational materials, we like contradicted each other. So the things really almost went out of hands until we started getting support from the WHO, CDC, and other countries and agencies flying into render support to our country. As I said, our health system is one of the poorest, and women are dying a lot, and children are also dying a lot with a very huge maternal mortality rates. And because of the lack of seriousness of the government, and which also had a lot of corruption, people using the Ebola situation to enrich themselves, because there are a lot of donations coming all over the world. So this level of seriousness to really fight Ebola wasn't there. And the fight was concentrated in the capital city with the big ministries, and little was done where really we had the epicenters. Until after the serious issues, health workers dying, because at the beginning, we were using the Lassa Fever Research Center, which is a very small hospital in Kenema, thinking because Lassa fever is also a virus disease, and thought could fit into handling Ebola cases. Unfortunately, we lost 80% of the medical staff at the center, including the head of the hospital and my aunt, who was the head of the nurses at the hospital. They all died. That was the time we took the situation serious, and that was the time the health minister was relieved of his job, and Ebola response structure put in place to handle the situation. And at Namati, we are working, we're a very small team, but working with a lot of partners all over the country who are like frontline paralegals doing work. Immediately, we are able to integrate awareness raising around Ebola into the programs. As I said, the messaging was in itself very confusing. We knew very little about Ebola, and but the paralegals did their best, and we are using the community meetings, engagements, working with people in the community to help in the awareness raising. Also, at Namati, fortunately, we had a toll-free legal advice line, a 369 line. That line turned into the national line. People call to seek for advice for Ebola, what they should do, where to go. And that one again was, we are not very prepared for that, because the paralegals who we are on the receiving end of these calls, we are trained in justice issue, land, domestic violence issues, and not issue of Ebola. And quickly we got somebody to help bring these guys to speed so that they'll be able to receive these calls and at least give information to the public about what is happening and what they should do, what are the symptoms. They should not touch dead bodies. They should go to the health center when they feel this and this kind of symptoms. And later on, we got the government to also start their own line, legal advice line. So that's easing the burden on us at the matter. I would say it took time for people generally outside there to go by the guidelines of the Ministry of Health. But we at NAMAT, we are very strict, and we made sure we had people to wash their hands and use hand sanitizer before entering the office, and we reduce the number of visitors to the office. And increase the use of the 369 line, which was free, which our clients will call us, and the paralegals will be able to give first-hand information to them about their cases and also about Ebola. We also had a health accountability project in our hands. Around the same time, we had Ebola. And we use the different health structures to make sure people get the right information. As I said, what happened at the beginning was like government using the different ministries at the Freetown, the headquarters, to to do the Ebola work, which was not working. So we use the structures similar to what we have in Mozambique, the facility management committees. These are committees that are set up by governments to help the health facilities at the village level. We use the paralegals to train these facility committees for them to also pass on the information in the remote, very remote communities about Ebola. And there was a time with all this effort, because we are ill prepared, actually we thought we lost the fight for Ebola. Definitely Ebola reached Freetown and the figures were just going up, similar to what we are seeing in America. We thought we are losing this battle. We are losing this battle. Maybe that was the peak of whatever. With that one, we had no option but to retreat and to come back and work remotely from our offices. And we're working from home and we rely on our 369 line. And we also had Sonkita at some point travel. We had remotely, we called Sonkita and other staff for advice, and we passed that one to our staff. But we retreated and came back to our respective home and started working from home as we are doing now. And after that, we saw the curve being flat a bit. Then we are back on our feet because the pressure from our client was so much. I will tell you, some of the companies we are working with want to take this as an advantage to move on with some of their bad dates. And we are getting these calls from communities down there saying, these communities are coming to do this, they're coming to do this, they're taking advantage of the Ebola situation. And that prompted us, because we saw the figures coming down, and we started taking some risks again to go. We got some passes from State House, but we are very careful. We had our regulations, internal regulations, how we about social distancing, how many of us will be in a vehicle, we should not interact directly, we should not go close to people, because for the Ebola, it's only when you touch a sick person, then the Ebola will transfer to you, unlike the COVID-19, which had some way is transferred at a pace miraculous in some ways. But the Ebola, we knew we have to touch somebody, so we are very conscious. So we had to go back to the field, but we're very conscious about how we interact with communities and how we work things. And at Namati, we are like, at some points, the few NGOs that we are really seeing working during the Ebola time, though not physically all the time, but with our 369 meet was very popular. And also with our internal kind of mechanism put in place. Fortunately, we lost no one, but we carry the responsibility to quickly repatriate those interns who are with us, Americans who are with us, working with us. But we are so afraid that we quickly got them back home. But we are able to manage the situation. We lost no staff at Namati.
Thank you. Thank you very much, Daniel. Good to hear that that phrase, back on our feet. We hope we can say that after a few months. And we have so much to learn from the Ebola experience that you had in West Africa and how you continued your legal empowerment work despite the difficulties. Let us now discuss the pandemic's effects on specific vulnerable populations and the justice issues arising from either the crisis itself or government's action. Let's start with the prison population. Prisons are potential epicenters of COVID-19. In many countries, they are overcrowded and the population several times over capacity. The Commonwealth Human Rights Initiative, founded in 1987, has its prison reform work as a major program of its access to justice program. Let's ask Madurima. Madurima, can you please tell us how you are responding to this crisis?
Yeah, certainly. As you said, prisons with their overcrowded spaces and inadequate healthcare facilities are at a high risk of becoming epicenters. And that's true not just for India. I think it's true for a majority of the countries in the world. And interestingly, this crisis seems to have brought some spotlight on overcrowding, with governments worldwide, with organizations calling for releases and trying to reduce the overcrowding rates. Similarly, in India, the Supreme Court had in March taken suo motu cognizance of the issue, and they directed the setup of committees to across all the states and union territories to take a review of cases and order the releases, or at least direct the authorities to make releases of both convicts and unsentenced prisoners. They've also been seeking response, trying to find out what are the precautions that are being taken in the prisons. So there is some spotlight from the court, which has actually helped in a good way. And at CHRI, we've been trying to respond to the crisis as best as we can. We prepared a guidance document back in March, which contains practical guidance on the precautionary steps that prisons should be taking, and we circulated it widely to all the prison authorities and the legal service authorities that are in our advocacy network. So we have, because of our work, which has got spanned so many years, we have contacts across most of the states, and we've been using that to kind of keep in touch with what's happening in every state in UT. One of our major focuses has been to, because there were some cases of rioting here, and which was mostly due to permanent absolute bans on visitation, etc. So we've been focusing a lot on how to ensure that authorities, and particularly the legal service authorities, are actually making prisoners aware of the situation, and they're informing them about the restrictions, informing about the virus, what it is, what kind of self-hygiene measures they need to be taking. That being a focus, we've also been recently, due to the nationwide lockdown, we've also been concerned about provisioning of safe transit and sustenance of prisoners once they're released. There were a few cases where prisoners were stranded after they got released. So we've been trying to address that by, kind of advocating with the authorities to take action to kind of stop it. We've also been very recently now on our website, we are now actually tracking the number of releases, because most of the states have given high numbers of they will release so many prisoners, but the actual releases are far less. So, and we also want to understand whether release of a few prisoners here and there actually makes any difference into the overcrowding rates. So as of today, the number of releases that have been made still far, there seems to be a 9% reduction in the occupancy rates in prisons across the country, which is quite good, and we're hoping that there will be more releases soon. Though we are concerned about the temporary nature of the releases, meaning that most of the places the releases are either for 45 days or 2 months, and then after that prisoner is expected to come back into the same overcrowded spaces. So that definitely remains a concern. However, we continue to strategize on ideas to address the situation as it arises. There's another committee called the Under-12 Review Committees here, which are headed by the legal services authorities, which is supposed to meet weekly and decide on the cases that could be released. So we're trying to track their working as well. And we're hoping that, we know that the journey is going to be long, but we hope that we will be able to make interventions as and when required to assist and ensure that the rights of the vulnerables in prisons is not violated in any way.
Thank you, Madurima. Earlier, Whitney mentioned some government actions that are needed to buy us time: social distancing, lockdown, shelter at home policies. In some communities, however, like in informal settlements in cities, these measures are simply not feasible. What is the impact of the pandemic on communities in informal settlements? Let us ask Felipe how they are seeing the impact of the pandemic to communities in informal settlements in Buenos Aires, in other cities in Argentina, in Latin America, and how is ASIJ, the organization, responding to the situation? Felipe?
Okay, yeah. First, I think it's important to say coronavirus has unveiled in Argentina some hidden and little discussed social problems, such as the access to adequate housing for all. In this sense, in a country where we have a weak tradition of state regulation of the land and housing markets, the national government decided to suspend evictions for non-payment of rent, freeze rental prices, and forbid the cut of public services during the health emergency, among other measures. Even though the problem continued for or marginalized communities. These solutions don't fit in the reality of informal settlements, where rentals are not written, evictions keep happening, and services are not state guaranteed, so frequent outages continue. Also, there are some other problems that emerge with the implementation of compulsory isolation regarding informal settlements. We can mention housing insecurity and overcrowded conditions. In Argentina, the population living in informal settlements is about 10% of the whole population, and 35% of those who live in informal settlements are living in critical overcrowding conditions. Then the lack or deficit of access to public services like drinking water. In this sense, 93% of slum dwellers have no access to the formal network that provides water. Starvation arises also as a growing problem for a big part of slum dwellers, that their livelihood depends on day-to-day income because they work in informal activities. And also the escalation of daily violences in informal settlements, repression in a context of the strong legitimation of police violence, which is also added to other violences that take place in the domestic sphere, such as gender violence. So the pandemic is not just portraying, but it's also increasing the discriminatory effects of urban inequalities and segregation. In this context, in ASIG, we are doing some advocacy actions. We launched a campaign in social media with other organizations to answer somehow that hashtag that says stay at home, by highlighting the idea of housing as a right and stating that to stay at home, first you need to have one. Considering that in the city of Buenos Aires, for example, there are more than 7,000 homeless people. With this, we're trying to overcome or reflect about that common view that says that everybody's affected in the same way by the virus, like universalizing risks and erasing somehow social pre-existing asymmetries. Also, with other organizations, we wrote a document with proposals for public policymakers to face coronavirus and prevent the economic and social effects of the pandemic on the most vulnerable groups. In the document, we emphasize the importance of thinking housing policies in coordination with sanitary and development policies. And finally, we continue our work with communities based on legal empowerment. We are in permanent conversation, though there are many obstacles, mainly because in legal empowerment, closeness, the sense of community that we are building, and the presence of bodies together that are incorporating, embodying the legal language are very important. And all of this is particularly hard in a moment where collective relationships seem to be almost as a threat for you and your health, and even as something illegal. So for these reasons, we think that legal empowerment perspective and the human rights approach are extremely relevant in a moment when there's a feeling that our bodies belong more to the states, more to the medical system's prescriptions than to ourselves. So we are adapting our work, and we are about to launch a map of legal needs so that slum dwellers can have easy access to regulation and public agencies where to go to enforce their rights in this context.
Thank you, Felipe. Siege has rich experience of work with communities in informal settlement since it was founded in 2002. Whenever countries are hit by crisis, women and girls are worse affected than males. There is disproportionate impact on women. ESE has worked with women and girls in North Macedonia since 1994. Jasminka, can you please tell us what gender impacts are you seeing from this crisis, and how do you adapt? How does ESE adapt to the situation?
Yeah, okay. So as Whitney has already said into the introduction of this webinar, we are all facing an unprecedented times practically. So for a gender equality kind of a perspective, we face a situation where everything that we have gained in the past is threatened. And moreover, practically the lack of response of the formal systems of protection which are run by the states in this emergency situation, is also worsening actually and deepening the inequalities that already had existed. And there is no doubt that there is that all issues or all kind of sectors or all types of how should I say parts of our lives and livelihoods are in stake. And we are now having an early estimation, let's say, how the pandemic is influencing over us, all of us, and especially women and girls. But however, based on the inequalities that already had existed, there are a few issues that I would like to share with you in a way how this pandemic is kind of having a more impact and intensified impact, or actually it's amplifying the inequalities for women and girls. As we all nowadays are kind of witnessing is, first of all, the economic impact. And that economic impact, that kind of the economic actually impact is visible through the massive layoffs, and especially in the sectors where women work, and that is mainly into the sectors of retail, services. So practically women are overrepresented in those sectors, and the layoffs are having really a negative impact over them. We also are witnessing the layoffs into the informal economy. The women who are working in the informal economy, what is actually an added kind of a negative impact is that they cannot benefit, that they cannot use the social benefits, which is kind of derived from the formal kind of a way of employment as such. There is also an assumption that the women's participation into the labor force will decrease as a result of the pandemic, and of course, consequently, the women will earn less income than the rest, or than the men actually. But beside the economic kind of a side or point of view, there is also a negative impact over the health of women. Namely, we all know and we are all seeing that the women are at greater risk of exposure to the virus, because 80% in Macedonia of the healthcare workforce are women. It's consisted of women, and worldwide there is 70%. So practically they're on the front line. But beside that, women are usually using the public transport. They're going, as a part of their domestic work, they're going shopping, to groceries, which is also making them more exposed to the virus as such. And of course, nowadays, we are facing a situation where there is a diversification, or actually it's a diversion of resources. Everything is kind of diverted to the pandemic and the need for the pandemic response. And in that sense, let's say, well, it's maybe not a good word, but the common health needs of the people and the women are not cannot be met, and especially to women that relates to the sexual and reproductive health especially. The third issue that I would like to emphasize, which relates to the pandemic impact over the women, is the unpaid care work. I mean, as you all know, the unpaid care work is usually the care that women are taking for the older members or for the ill members of the family, and that is usually the invisible kind of a work that women are taking upon them. So nowadays, with the pandemic, we also have children that are out of the school, which intensifies the care work of the women as such, and also we have or may have a family member that is still from COVID virus, so that is also intensifying the care work as such. There is also an assumption that with the girls being out of school, especially the adolescent girls, they may be much more involved into the domestic work, and maybe after the pandemics they may kind of drop out of school, but it's also an aspect that should be taken care of from the educational point of view. And at the end, as Felipe also had mentioned, the primary measures for prevention of the pandemic is isolation and confinement. And unfortunately, the isolation and confinement for some women had resulted into the increased family violence, either by their partners, husbands, or members of the extended family with whom they are living. And practically, there are certain estimations that the family violence has increased for 25% in some countries, 30 to and in some countries that is almost, they have estimated that it's increased to 50%. But maybe that's not, let's say, what should worry us. What should worry us is in the case of domestic violence and family violence in general, is that the formal system of protection has been paralyzed, actually. So they are not able, they're kind of overwhelmed with the response to the pandemic, so they are not able to kind of respond to the immediate needs of the victims of family violence. So usually the services that are normally provided now, they're totally kind of lacking to kind of cope with the whole situation. In our country, we have an additional factor which is related to women that have suffered family violence, and that is that the legal protection, which is of course an issue on which we are talking about on this webinar, was suspended. And the only cases that are kind of a proceed or on which you can seek a protections are the so-called issuing the restraining orders, practically. So there is an urgent procedure, and the second one is only related to the change of the children's custody. So only those two procedures are allowed to be proceeded in front of the courts. So having in mind this kind of a situation and the impact that the pandemic has over the women, what we have tried over the last month in responding to the pandemic is actually we try first of all to fill the gap of a lack of the service of the information, a specific information to a specific kind of a target groups, I mean women especially. So practically we have identified guidelines and manuals that were translated into the Macedonian language. And that were disseminated over the social media, Facebook, also the contacts that we have electronically, but also through the activists that we have in the communities where we work with, especially with vulnerable groups of women. So practically we have translated manuals like for example, how the pregnant women should behave, how the mothers who are breastfeeding their child should behave, or take into account the parents. Then if a woman is taking care of someone who is ill from the virus, the recommendations and guidelines and so forth. What we're also doing in this time is that we try to inform government about the obstacles that the women are facing in seeking help from the formal system in order for them to kind of respond to the urgent needs of the women. And lastly, what we did is kind of a protocol how the state institutions should proceed in emergency on the cases of family violence reporting. So we can be all, let's say, be sure that the institution have kind of received the complaint and have promptly proceeded on the cases of domestic violence. What we also did is that because we are in an emergency situation, we have an executive government that is practically issuing different types of decrees, which have the force of a law, which means that they're having a certain impact over the implementation of the rights of the women. So what we do, we are trying to translate those decrees, not literally translate, but to kind of make them friendly, in a format of a friendly information for the women, for them to understand what is the power of those governmental decrees and how do they influence the implementation of their rights. And especially we have done that with the judicial system kind of operation, or the suspending of the judicial system operation. We also did that with the degree that is related to the labor kind of relations rights, and also the social benefits that are currently disposed to the population. Of course, as an organization that is working and providing direct services to the women, we also are organizing different types of kind of actions to raise funds for certain women that cannot be sheltered and do not have kind of any other choice in this type of a situation. And at the end, what we did is also initiated kind of a small poll for the assessment of the initial, let's say, impact of the COVID on women and girls in Macedonia.
Thank you very much, Jasminka. And that point that you made about government actions is a good segue to our next issue. We have seen a number of government actions, lockdowns, shelter at home, and we have seen a number of countries putting limitations not only on freedom of movement but also on freedom of information. In some cases, even freedom of expression. And many of us fear that the pandemic could be used by some authoritarian-minded leaders to gain more powers and to tighten their grip. Let's go to the Philippines. As you know, the Philippines has gained global attention recently because of the government's so-called war on drugs, and now we are in a different crisis. Let us ask Faye, how is the Philippine government under President Duterte acting on the situation, and how are civil society organizations responding to the challenges? Faye?
Right. Right. So a few days after the WHO declared a public health emergency, President Duterte said that he will utilize the military and the police to instill order and obedience in case this turns out to be a pandemic. At that time, around February, we were still dealing with the unrest of Taal volcano. So Taal showed signs of eruptive activity, covering some parts in the south of Luzon with ashfall for weeks. People there were evacuated and the most affected areas were placed on lockdown. So we really did not see much focus on the virus until early March after recording 10 confirmed cases, including one local transmission. As I've said earlier, Luzon has been on enhanced community quarantine since March 16. Its enforcement includes deployment of military and police to checkpoints and the implementation of curfews. Travel was restricted because mass public transportation was prohibited, and non essential businesses had to cease operations in the meantime. Clearly, as we've seen, the government saw the pandemic as a peace and order issue, and this raised red flags within human rights, civil society organizations, and advocates. And given this government's track record, advocates feared that there would be human rights violations during the quarantine. And true enough, on the first day of quarantine, police arrested a 69-year-old homeless woman for being outside and charged her with resistance and disobedience. Several men were locked up in a dog cage for breaking curfew. It was particularly disturbing when an official of the national government said that during quarantine there are no human rights. He even went as far as saying that the writ of habeas corpus should be suspended during this time. At one point, like around mid-March, the president asked Congress for additional powers in light of the pandemic. Among the powers he requested were the temporary takeover of privately owned public utility or business, which will be determined by the president, and these included public transportation and telecommunication entities. He also asked for the power to reallocate savings within the executive department. Luckily, Congress did not just give him all of these powers that he asked for. The law now provided for limits on the exercise of the powers, and they specified the how the budget should be reallocated. The presence of security forces in addressing the situation, the lack of clear directives, especially during the start of the quarantine, and the varied levels of enforcement have contributed to abuses of authority and human rights violations. By the end of March, around 17,000 people have been arrested nationwide since the quarantine. These arrests include violations of curfew and expressing grievances against the government online and off. Because there was a lack of consideration for the socioeconomic aspect and effects of the quarantine, and this was mentioned by the other um, leads earlier, the other presenters earlier, people in the margins naturally would still try to make a living because they work on a daily wage. 21 people were arrested after holding a rally intended to express the lack of aid in their community. Some people would just resort to posting their feelings or their criticisms on social media at the risk of receiving a subpoena from the government or being asked by local government officials to issue a public apology. Sadly, health workers here are also being discriminated against. There have been reports of eviction by landlords or dousing with chemicals by neighbors because they fear that the health workers actually have the virus. In response, CSOs have formed quick response teams. Some have partnered with the Commission on Human Rights for documenting and monitoring human rights violations. Legal resource groups released informational materials about one's rights at checkpoints or during arrests, freedom of expression online, and relevant court procedures. Some groups have made themselves available for legal consultations, and the CSOs act as watchdogs and issue statements when necessary. And when the situation calls for it, actual court appearances have been done for important and urgent cases. While efforts to provide virtual legal assistance have helped ease some tension, the need to physically respond to arrests is still posed as a challenge. There's a limited availability of public interest lawyers and groups to help the vulnerable communities. And, this limitation could contribute to other possible human rights violations, such as one's right to independent counsel and other rights of the accused. It is worth noting that other CSOs have provided online psychosocial interventions. Some groups have also provided hot meals to frontliners, and some have coordinated with local seamstresses to produce PPEs and masks. Moving forward, we do intend to gather the documented cases, compile all the COVID-related issuances, and analyze them to craft legislation for public health emergencies in the future. We also recognize, and this is more so now, the importance of training more paralegals and the value of having and strengthening a network of paralegals. As a last note, what I personally found interesting about the whole ordeal is that the pandemic has opened a lot more minds into being critical about the government's work. We saw an increase in people participating in discourse about issues and asking the important questions. We also saw how people really come together with solutions to help with the cause. And this gives me hope. Thank you.
Thank you, Faye. We're seeing a mix of the good and the bad in this crisis in our different in different countries. Okay, before we move to before we open the floor for questions from our participants, I will give Whitney a few minutes just to give some quick advice. The legal empowerment groups apparently are continuing with the work despite the crisis, addressing the justice issues. What advice can you give us, Whitney? Legal empowerment groups, and we have uh, almost 300 attendees, most of them representing groups who work directly with grassroots communities. Some quick advice for us. You're muted, Whitney.
Sorry, I thought I had unmuted. So it's really heartening to hear how much work is going on still. I think there is a couple things to keep in mind for legal empowerment networks that I'm hearing already a little bit of. But the first is just the role in translating, not just in language, but culturally and locally, these basic messages on prevention and also preventing the spread of misinformation. So that's something that I've seen a lot of on the Anamites network, how much work is been doing by these trusted grassroots networks in preventing the spread of of misinformation and getting the right messages out there. So that's a first piece in pivoting work a little bit. The second piece is, as these measures are implemented, feeding back that information from the community back into the government, as Jasminka mentioned, about what is actually happening. I would encourage everyone to find out which grassroots networks are actually doing health work. And although it may not be ramped up yet, eventually that work that I mentioned around case detection, contact tracing, and safe and legal isolation of cases and quarantining of contacts will hopefully be happening. So if you don't already know who in your country, who in your community is going to be doing that, finding out who is going to be doing that, because we will need every grassroots network to be doing that, and the role of legal empowerment organizations is going to be especially important in that. Also being able to learn a little bit more about what is legal during a quarantine, starting with WHO's guidance and UN guidance on what legal safe quarantine looks like to protect human rights, is a first step that you can take while you're on lockdown or in shelter in place, and educating ourselves and our networks about that so that we can be ready to defend that. And then the third support is the massive recovery effort that this is going to take. So like I said, most people are going to recover, but people are going to be very, very ill. So even moderate cases, you may see people who have pneumonia for several weeks. You may see previously healthy individuals that are going to recover, but are not able to care for anyone else in their household, that are not able to care for themselves, that are quarantined, that are isolated. So we're going to have a massive leverage of grassroots networks to be able to do that care in the community and make sure that we don't have excess mortality because people could not get those services. So those are the three things that I would say beyond the amazing work that's already being done to start to find out who is going to lead those efforts that your network can tap into. Remembering to keep yourself safe. So learning more about all the information and what work is happening even over flip phones. So there's a lot of organizations that are doing massive communication and networking via flip phones. How to do social distancing properly, making sure that you are keeping 6 feet from everyone. Learning what the recommendations are in your country for using masks appropriately if you choose to wear a mask. Understanding how to do that without harming yourself or others. So how to take it on and off, how to wash it correctly. So making sure that you are going to be very well protected when you do go back out into your community. So love to pick this conversation up further in our online discussion, and happy to do more detailed resources of what can be done.
Thank you, Whitney. We will now open the floor for questions or comments from our participants, and we have received a number of questions through the question box. Let us start with Sarah Hussein from Bangladesh. Sarah, can you unmute Sarah? Sarah has some questions.
Hi, thanks so much, Marlon, and thanks to all the speakers. Marlon, I had a few questions. Do you want me to just put all of them at one go?
Yes, and please be very quick.
Yeah, absolutely. So I just had one question for Madurima, which was about how we could, about clarifying about whether the Indian groups have been assisting prisoners with the actual release process, getting them home, communicating with their families, and how have you addressed the issue about concerns being expressed about whether prisoners should be tested prior to release? And another more general question for everybody on the panel really was about how do we ensure better coordination in country as well between service providers, because we're finding that we are still being able to provide some services through hotlines, for example, and many people are diverting into doing relief and helping with food distribution and so on, where government has started that for vulnerable communities. But what we're hearing from all of you many suggestions for bigger things we can do, advocacy and so on, that can happen around critical issues like informal settlements and other things. So how can we do more to push those same messages across all of our different spaces in different countries? What further coordination is possible thematically there? And a last question again for all of you is, how do we encourage some of our more repressive governments to open up and not close spaces? And how do all of us as legal empowerment organizations play a role in helping to open space and not close it? Because unfortunately, in many of our contexts, collaborating, supporting government means having to be silent on other things, but that isn't something I think we can afford to do right now, nor could we ever. So just a question for all of you on how to manage that. What examples you have? Thanks.
Thank you, Sarah. So we'll start with Madurima, and I just want to inform Madurima that we have a similar question from Marcela Olarte from Colombia, asking about releases from prison. So we'll start with that.
Yeah, hi. Hi, Sarah. Thank you for your question. So yes, Indian groups have been assisting in the releases in terms of getting the prisoners back home safely. And what we've been doing on a national advocacy level is writing to the concerned prison departments, prison officers we know, to the legal services authorities we know, and we're also collaborating among our own organizations who we are partners with or who we know to kind of track what's happening in that area. And they are from reports from many parts of the country where assistance has been given. And one interesting authority, or the legal services authority, has actually come up quite well, and they have also been working with NGOs to enable assistance to prisoners. There are also reports of cases where prisoners' families are also being provided assistance and subsistence by the DLSAs, that's the legal services authorities here. So yes, there's a lot of work going on the grassroots on that. In terms of the testing prior to the releases, yes, there is. So we have in our notes, there are a couple of notes that we've been making on this. They're all available on our website. In all our notes, we have emphasized that, you know, it shouldn't be a situation where the prisoners become the carriers and they end up transmitting the diseases there. So we've emphasized on pre-release testing that needs to be done. Whether it's been done across the nation, we really don't know yet, but we are trying our best to kind of document all information that is available through the prison authorities, through the legal services authorities, and we're very we're hoping that we're probably going to document it all together and put it out somewhere. So hope that answers your query.
Thank you, Madurima. What about the other questions? Any of our lead discussants want to answer that?
Okay, yeah. I think that most of the documents we did were with other organizations of Latin America. The document that makes proposals of public policies is done with some other organizations of the region, because there are several commonalities between informal settlements in Latin America. So I think that in that sense, we are trying to keep a double scale work, with the social movements and organizations that are assuming like a very important place in the middle of this crisis, because they are delivering food, they are fulfilling some social needs in informal settlements, and also with regional civil society organizations that are thinking in public policies and how to make advocacy actions to make governments react somehow in this crisis, and keeping in mind the economic effects of this pandemic in Latin America. So I think that it's a work that has like a double scale.
For non-legal related coordination, it is a really tricky question, which is why I'm suggesting that everyone is going to have to do a little bit of your own local research. But The UN should provide the framework, and the UN offices should be at least providing the coordinating mechanism for response. But then you're likely to see the most robust activities being led perhaps by some of the leading NGOs that have been doing health previously in your country. I would probably start with the International Federation of Red Cross and Red Crescent Societies, as they have a huge lead in disaster response on health disasters. So checking there first to see what's happening. And if you have no other leads, like just asking them who actually is leading response would be one place to start.
Any other response to Sarah's questions?
I think aside from what has been mentioned about advocacy and policy reforms, it works to collaborate with government and civil society organizations, including private institutions. How do we encourage governments to be open to this? I think we can, like, right now we're still trying to figure that out, honestly. But in order to address that, I think we really have to review everything. Once this is all over, we need to review everything from information, data that we gather from communities, and bring them up into legislation that would be more inclusive, and that would have concrete or direct plans in addressing the different aspects of the pandemic.
Thank you. Thank you, Faye. I just want to check if there is anybody from Advocate Sierra Leone who is with us. Advocate also has some very good experience in continuing the work, especially on persons incarcerated during the time of the Ebola crisis. Do you have anybody from Advocate? Okay. We have a number of questions sent to us. One question is, I don't know if we can answer this now, but there's a question on whether there are guidelines on the integration or mainstreaming of legal empowerment in humanitarian work, in humanitarian crisis like this one. And would you know, Whitney, if there are particular documents, guidelines on this?
I would refer people first to WHO's guidance on quarantine and stigma. So those are the first pieces from a health perspective during a crisis that I'm more familiar with. I'm not familiar with general guidance on general legal empowerment during a crisis of this scale. I don't know that anybody has quite written the book on that one yet, but I would say that that's the first piece to look at. Another interesting piece that is happening is a lot around privacy, data protection, and surveillance. So that's something very new in this particular crisis, that you'll see governments working to track people electronically. I do know that the European Union has released the first set of guidelines on privacy protection, surveillance, and tracking, and that any kind of surveillance, any kind of technology surveillance that's used, what kind of guidance and standards that should meet. So that's not exactly what you were asking, but just a very interesting wrinkle that we're facing in 2020.
Okay, thank you. I don't see any. I don't see any raised hands. But please let me know, Martha and Michael, if there are participants who want to raise their questions directly. But I'll read some of the questions that we have. We have a 3-page list of questions. We will not be able to answer all of these, but we can continue our discussion on on the forum. Oh, we have Lydia Winnie from Advocate. We are now unmuting you. Can you please share give us some updates and share some experiences of Advocate during the Ebola crisis?
Well,
Yes, go ahead, please. We can hear you.
all right. Good afternoon. I'm here with the paralegal who was actually present during the Ebola time. But of course, we as advocate during this lockdown and especially the state of emergency, we know that the repercussions and these containment measures are really being acutely felt by the world and actually the country's most vulnerable populations. We work, of course, in the community with the most vulnerable, specifically women and children. And of course, limited mobility has interfered with their access to healthcare, food, basic needs like water. And so some abuses have been committed during arrests and detentions of these women and children accused of having violated the curfews, the lockdowns, and state of emergencies. But we have continued with our work through monitoring of police stations and even during the lockdown in the communities, where of course we shared the information that we got from people who are arrested for maybe moving from one place to buy bread, to fetch water, were all captured and shared on WhatsApp. We are still working with partners. We were not given a pass, particularly for the lockdown monitoring. However, we worked with some partners like GOAL to ensure that we can continue with our monitoring, because despite the fact that there are these measures, human rights must still be observed as a basic for the people to maintain their dignity as human beings. So I'm here with a paralegal. She's Namsa Toronka. She can share her experience in what she has been doing currently, but also during the Ebola time.
Hello.
Yes, please go ahead.
Okay, good afternoon. As justly as Ms. Kemba have highlighted, during the lockdown, because we were not given much access to be at the police stations, but we decided before then I had a plan at hand where forms were organized and we were able to drop them at the various police stations that we've been monitoring, and we spoke to the head of the police stations like the SS, that the station sergeants, because those ones are always present. So they helped us to fill in these forms that were there whenever they had arrest for the 3-down lockdown that occurred. And after the lockdown, we went and collected these forms and we were able to share the information with the advocate team. And also after the lockdown, we've been continuing our monitoring at various police stations, where we also realized that some people were also arrested for the COVID-19 activity report form, which we created. And we realized that some people also arrested, as stated earlier, because there were lack of basic amenities like water and food stuff. So people had to go out to fetch water, and then they were flogged and beaten by the police and some military men. And also we intervened, we went there and spoke to some of the police officers, and some of these people have been able to granted bail. They were granted bail and released to go to their various homes. And as for the correctional centers, we have been stopped for quite a while now since the occurrence of the virus in the country. But what we did was we gave them forms also to the commanding officer in charge, and we made phone calls as a follow-up monitoring procedure. Hello. And also one of the things we realized with the lockdown for this time is that compared to the Ebola crisis previously, because the Ebola, it was the first time that Sierra Leoneans really were asked to stay home. So we realized at that time the violations are a bit much and larger scale rather than the COVID-19 violation scale, because now at least they've been able to cope with it. It's just that what really made people to come out was the lack of basic amenities that were not provided for and made available by the government. So the IS scale is not too large compared to the Ebola crisis that we had previously.
Thank you very
Thank
much.
you.
Thank you, our friends from Advocate Sierra Leone. We had a very interesting discussion, and until now, we have more than 200 attendees in the webinar. Unfortunately, we don't have time. We still have many questions and comments from our participants. We are closing the webinar, but we are definitely not ending our conversation. We have just started. So we invite everyone to join us as we continue this conversation about continuing our work for justice during this global crisis. In the discussion forum in our website, we have opened a dedicated online space for this discussion on legal empowerment during the pandemic. There are some questions addressed specifically to our lead discussants. So we request our lead discussants to continue responding to those questions. We will be organizing discussions similar to this webinar, but focusing on specific geographic areas or thematic issues. Like we are receiving many questions and comments about incarcerated persons. So that's one group that we're thinking to convene. And we want to announce that there will be a webinar in Spanish, Acceso a la Justicia durante la Pandemia, on April 23 at 11 a.m. Eastern Time, 3 p.m. GMT. So we'll be having more conversations in the website and virtual discussions through webinars in the future. So together, we will explore ways of supporting each other in this extraordinarily difficult, challenging period. We will share the recording of the webinar and some useful resources. You can check the website and the COVID-19 online sharing space that we have that we have opened in the website. So again, we thank our lead discussants. Thank you very much, Madurima, Whitney, Jasminka, Faye, Felipe, and Daniel. Despite having connection difficulties, Daniel is still with us, and Vivek is still here with us. Thank you very much on behalf of NAMATI and the Global Legal Empowerment Network. Thank you for attending this webinar. And again, this is not the end. We will continue our conversation in future activities. Thank you very much. Goodbye, everyone. Thank you.
Yeah, thank you.
Bye, everyone. Thank you.